Hey future doctors, today we are going to see about necrosis. So necrosis is defined as localized area of death of the tissue, followed later by the degradation of tissues by the hydrolytic enzyme liberated from the dead cells, and it is invariably accompanied by the inflammatory reactions. So basically in necrosis, there is a death of the tissue which is then followed by the degradation of tissues. Then necrosis, it is caused by some agent, that is hypoxia, then chemical and physical agents, microbial agents, immunological injury, and many more. Then based on the etiological and the morphological appearance, there are 5 types of necrosis: coagulative, liquefaction, caseous, fat, and fibrinoid. So first we are going to see about coagulative necrosis. It is the most common type of necrosis, and it is caused by irreversible focal injury, which is mostly due to sudden cessation of the blood flow. It is also known as ischemic necrosis, and it is less often from the bacterial and the chemical agents. The organs which are most commonly affected are heart, kidney, and spleen. Then the gross features. In the early stage, it is pale, firm, slightly swollen, and it is known as infarct. But with the progression, the affected area become more yellowish, softer, and shrunken. You can remember this by doing opposite of this. Pale, it becomes yellowish, then firm, softer, and slightly swollen, shrunken. Next is microscopic features. The hallmark of coagulative necrosis is the conversion of normal cell into the tombstone. Now, tombstone means if there is a cell, then only the outlines are retained. The inner cytoplasmic and the nuclear details are lost. This is known as tombstones. Then in this necrosis, the cells are swollen and they are more eosinophilic cytoplasm than the normal. The nuclear changes are seen as pyknosis, karyohexis, and karyolysis. Then cell digestion and liquefaction also fail to occur. Now what do you mean by pyknosis, karyohexis, and karyolysis? So we will see this diagram. So this is a normal cell. In pyknosis, we can see that the nucleus is shrunken as well as the cytoplasm is more pink. Then third is karyohexis. It means the nucleus is fragmented, as you can see, and the pink color is again more darker. Then in next karyolysis, we can see that the cytoplasm is intensely pink and the nuclear material has disappeared. That is known as karyolysis. Lysis means breakdown. Now next figure is of coagulative necrosis in the infarct kidney. Here the affected area on the right shows the eosinophilic cytoplasm of the tubular cells with the outlines of tubules. Now next we are going to see about liquefaction necrosis. This occurs commonly due to the ischemic injury and the bacterial or fungal infection. Example are infarct brain and abscess cavity. So we will just see the gross features of this. The affected area will be soft with the liquefied center containing the necrotic debris, and later the cyst wall will be formed. Then microscopic features. The cystic paste contains the necrotic cell debris and macrophages which are filled with the phagocytocyst material. The cyst wall is formed by the proliferating capillaries, inflammatory cells, as well as proliferating glial cells. And in case of brain, and proliferating fibroblast in the case of abscess cavity. So as you can see in this figure, this is granulation tissue and this is a liquefactive necrosis. On the right, as you can see that the cystic paste containing the cell debris while the surrounding zone shows the granulation tissues. The next is caseous necrosis. It is found in the center of foci of the tuberculous infections. It combines feature of both coagulative and the liquefactive necrosis. So the gross features are, it resembles the dry cheese and are soft, granular, and yellowish. This appearance is partly attributed to the histotoxic effects of the lipopolysaccharides, which are present in the capsule of tubercle bacilli, that is known as Mycobacterium tuberculosis. This bacteria is responsible for causing TB. Then here are some microscopic features. So center contains structureless eosinophilic material having the scattered granular debris of the disintegrated nuclei. And surrounding tissue shows granulomatous inflammatory reactions which consist of epithelial cells, then placed giant cells of the Langerhans and foreign body type as well as peripheral mantle of lymphocytes. So here as you can see, this is a caseous necrosis lymph node. This is eosinophilic amorphous granular material while the periphery shows granulomatous inflammation. As you can see that this is a caseous necrosis and surrounding this there is a granulomatous inflammation. So next is fat necrosis. So it is a special form of cell death which occur at mainly fat-rich anatomic locations in the body. For example, traumatic fat necrosis of the breast, especially in heavy and pendulous breast, as well as in the mesenteric fat necrosis due to acute pancreatitis. In case of acute pancreatitis, there is a liberation of a pancreatic lipase from the injured tissue, which results in necrosis of the pancreas. In fat necrosis, there is a hydrolysis as well as rupture of adipocytes, which are causing the release of neutral fat, which changes into glycerol and free fatty acid. So here, fat is getting converted into free fatty acid as well as glycerol. The leaked out free fatty acid complex with the calcium to form the calcium soap. The free fatty acid which is leaked from this get mixed with the calcium and it forms the calcium soaps, which process is known as saponification. Then here are some gross features. The fat necrosis is yellowish, white and form deposits. Then the formation of the calcium soap imparts the necrosed foci firmer and chalky white appearance. Then microscopic features. So the necrosed fat cell have cloudy appearance and are surrounded by inflammatory reaction. So formation of a calcium soap, it is identified in the tissue sections as amorphous, granular, basophilic material. So here as you can see, this is a diagram of fat necrosis in acute pancreatitis. Here you can see cloudy appearance. This is a mixed inflammatory cells. and the mixed inflammatory cells are on the periphery of the cloudy appearance. So next is fibrinoid necrosis. Deposition of a fibrin-like material which has staining properties of fibrin such as phosphatoxalic acid, hematoxylin, PTAH stain. For example, immunologic tissue injury, example in immune complex vasculitides, autoimmune diseases and many more. Then arterioles in the hypertension, peptic ulcer, etc. Then here are some microscopic features. So fibrinoid necrosis is identified by the brightly eosinophilic hyaline-like deposition in the vessel wall. And necrotic focus is surrounded by the nuclear debris of neutrophils. And local hemorrhage may occur due to rupture of the blood vessel. This is fibrinoid necrosis. This is nuclear debris. And these are viable PMNS. As well as you can also see that the vessel wall show brightly pink amorphous material and nuclear fragments of the necrosed neutrophils. So this was all about necrosis.